Hi, everyone. So this is Dr. Shelley Agarwal, and I have
Dr. Wendy McDonald,
also known as Dr. Everywoman.
That's me.
For those of you that know, we write a women's health blog called Gynecoblogic, just to talk about some common women's health things that maybe you want to read a little bit about before you go see your gynecologist, or try some tips or tricks before you go see them, some things that could help or work. And so we decided to put this together to help answer some questions as well.
That's right. And it's basically just going to be a good time. We'll be talking about things, and I want you to comment or send us messages if you have any questions or anything that you want to hear about and hear us talk about.
And this, of course, does not take the place of seeing your actual gynecologist, because sometimes a physical exam and being seen in person is exactly what the doctor ordered. But this can help answer some questions.
And we're corny.
And here we are. We hope to make this a good time for you.
Oh, my. All right. Also, we are going to, at this point, call this If Lips Could Talk.
Anybody get it?
Get it? Because we're gynecologists, if lips. Because these lips should be bold. They should be unapologetic. And
most importantly, healthy.
There you go. Moisturized. What are we talking about today?
So today we were going to talk about some common things that people come to ask us questions about when it comes to infertility.
Yes. Infertility defined as no conception, depending on your age. If you're under 35, it's 12 months. If you're 35 or older, it's 6 months.
And the important thing is it's no conception with unprotected, timed intercourse. So this doesn't mean that you just have been kind of, if it happens, it happens.
Right.
This means you're tracking your period, you're tracking your ovulation, you're obviously not using condoms or any form of birth control.
Pull out. Etc.
Right. And it has not happened in either 6 months if you're over 35 or 12 months if you're under 35.
Now, I do want to make the point, because some people come, and I don't know if you've seen people who said, like, well, I haven't been trying, but, we haven't gotten pregnant. Well, how long have you not been trying? Not completely unprotected? 5 years. Even though you're not really tracking your periods and, like, being conscious about it, you still could fall under the category of infertility, because it would be assumed that you would catch some of these ovulation times and that you would have an opportunity to get pregnant sometime in that space.
Yeah.
Not preventing is still kind of trying.
Right.
Is that fair?
That's fair. That's fair. I think anytime you're concerned, like we said, always good to come in.
That's right.
So Dr. McDonald, can you tell me some of the common reasons a woman might have a hard time getting pregnant? So, like, for the woman herself, some medical problems or issues that might make it difficult for her?
So some women are not ovulating. They're not releasing an egg every month. That would be something like polycystic ovarian syndrome or PCOS. That can cause people to not release an egg. You need an egg to conceive. As a matter of fact, you want to talk about the things that we need in order to conceive?
Yes. So there are a couple of different things that need to happen in order to have a successful conception. Now, the first thing, of course, is the egg. So that means that a woman's ovaries have to be functioning, you have to be premenopausal, you have to be releasing eggs every month or couple of months or however often you ovulate. Then you need to have a normal anatomy. So your tubes need to be open. They need to be, clean of scar tissue. They can't be blocked. The uterus itself needs to be free of like fibroids, big fibroids, or any septums or abnormalities that could be precluding once things match to actually implant. And then, of course, your partner needs to bring something to the party. So sperm, a good sperm count.
Two can play this game. No?
Two need to play this game.
And if you hear an offspring conception in the background,
that was how things did work in this situation. And here we are.
And they might just pop up out of nowhere, which is how some pregnancies happen.
Which is another topic, unplanned pregnancy, for another date.
We'll deal with that later. So back to things that can cause infertility. We're talking about like even the tubes and sperm, but the tubes need like clear passageway. So endometriosis can sometimes affect like scar tissue on the tubes. Sometimes even sexually transmitted infections can lead to scar tissue. What else? Ectopic pregnancy.
Right. So if you had a tube that was removed either during surgery or if you had an ectopic pregnancy, which means the egg and the sperm met in the tube and then they implanted there, that also can cause scarring. And then if you had that tube removed, of course, that can change improves your chances for fertility.
Absolutely. Now, to that point, say you have one tube that's removed or like scarred, but you have another functional tube, you can still get pregnant. Depending on the status of the one tube, like if the tube is full of fluid, that can affect your chances of conception because that fluid can kind of like mess up a conception of pregnancy. But if say the tube is just blocked or gone, you can still get pregnant with one tube.
You can still get pregnant.
It's reduced. Your fertility is a little reduced, but it's still there. It's
still possible.
There you go.
And so those are some things that can affect the woman's anatomy. Now, if you want to talk briefly about a man's anatomy, if you're dating somebody or if your husband or partner has never had children before, but they've had a history of injury to the testicles, if they've had torsion or testicular cancer, if they're basically anything that's increasing the temperature of the external genitalia for a man, that's going to cause the sperm to be abnormal. So riding bikes and everything is kind of squished up there and getting real hot, sitting with a laptop on your lap, sitting in saunas, hot tubs, all of these things, sometimes even just wearing briefs that are too tight, like tighty whities.
The tighty whities.
That also can cause sperm to be abnormal. So those are some things to know about your partner and see if there could be some issues that they have where they're not bringing good sperm.
Tell him to go to the doctor because if his blood pressure is up, if he has diabetes,
if he
even smokes, and even being overweight can decrease some fertility. It doesn't eliminate it, so don't think just because he's overweight y'all can't get pregnant. That is not birth control.
Don't start running around the house, right?
There you go. Oh my God. But no, everybody needs to be trying to be healthy, basically.
Right. We've gone over, you're a couple and you're worried and you've gone over your history and it doesn't seem to be anything obvious and you come to the doc and you're like, well, I get normal cycles, my periods are normal, so I'm pretty sure I'm ovulating, I don't have endometriosis, I've never had an STD. What are some common things that a doctor is going to do? And we're general gynecologists, we're not infertility specialists. But what are some things a general gynecologist can do or is going to start to do if you come in with this problem?
This video is going to make you not want to have kids because I asked them to be quiet. It was a simple request.
They haven't been this loud the entire time I've been here for the last 3 hours.
It was a simple request.
I've literally been here for 3 hours and they were quiet.
And now they're coming from the diaphragm.
And they're
from rooms away. Okay.
Mama!
Anyway, so simple initial evaluation. Sometimes we check your thyroid, make sure that it looks like that's working, because sometimes the thyroid that's abnormal can affect your fertility and your hormones and your ovulation and that kind of thing. We check to see if your tubes are open. There's procedures to do that. X-ray and ultrasound type procedures that can check for tubal patency, we call it, which is to see if the tubes are open. What else?
Right.
Just general ultrasound.
General ultrasound. Make sure you don't have big cysts on your ovaries. Make sure you don't have big fibroids.
Or polyps.
We mentioned earlier doing a sperm analysis is a great way to know we're bringing not only enough, but normal quality sperm to the party as well.
And checking for sexually transmitted infections.
Right.
You may not have any issue with your partner or even concern about any infections. However, sometimes there are things that are underlying that you don't even have any symptoms for or have any suspicion of that can affect your fertility.
Absolutely. Once all of that has happened, sometimes people will talk about testing for genetics to make sure there's no genetic abnormalities. That's a little bit more involved and further down the line. But that's kind of basically the questions to ask yourself and ask your spouse when you're trying to have a child. And also the basic things to expect. Something that can be really helpful that you can do before you see the gynecologist, track your periods and see if you have a change in things like your vaginal discharge or your temperature is a little bit higher. Track all of those things. And then when you come to the office, it's helpful to see, okay, you are ovulating. It looks like you're having regular periods. You have no other medical history. Those are all things that can be really helpful before you even come in.
Yes.
There's a lot of great technology and medications and help out there. So if you're ever, in this situation, get help because you can hopefully have a normal pregnancy and everything will be loud and rambunctious in your house as well. Energetic, passionate.
Annoying.
I mean, it's not my house, not my kids.
I can say that because they get on my nerves.
So thanks for checking in with us, and make sure that if you have any questions to visit our website, the Gynecoblogic. Dr. McDonald and I are both in the Chicagoland area. If you ever need a gynecologist, and check in with us next time for
If These Lips Could Talk. Bye. If these people come on into the screen, if you're gonna come in, you might as well. You get 2 seconds. Really? And the doctor.
Thank you, friends. Thank you.
Okay, you all had your time in the spotlight. She's in the doctor. She's doctor. Okay. Thank you. Go away. I only have so much tape. Thank you.